Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 37, Nat..MUR 3. Nat.MUR for pregnancy symptoms: vomiting of foamy, watery phlegm, morning sickness, falling of hair during childbirth and breastfeeding, dwindling of breast. Nat.MUR for respiratory symptoms: vomiting of foamy, watery phlegms in asthma, bronchitis, and pneumonia. In case of breathing trouble, use Kp, that is Kalium phosphoricum, Kali-phos salt, alternately. Rattling in chest, difficult to cough out phlegm, acute inflammation of windpipe, repeated discharge of foamy fluid, tingling behind sternum, dry boring cough day and night, with cough, headache, tears, stitching in chest, palpitations, leaking urine unconsciously, and also whooping cough. It covers also whooping cough. Two dots means this continuation of the previous slide, that is respiratory symptom. Pleurisy when inflammatory fluid accumulated within pleural space, stitching pain worse during inspiration, breathing short and fast, pains in back and shoulders, cough and fever may be there, hoarseness, aphonia. Edema of lungs, accumulation of inflammatory fluid in alveoli of lungs, severe breathing troubles, pain in chest as if respiration would cease, especially if lying down, cough, foamy saliva from mouth with tinge of blood, cold clammy sweat, anxious face, blue lips. In almost all cases, characteristic tongue symptoms are there. Characteristic tongue symptoms mean characteristic tongue symptom of Nat.MUR. It has two types of characteristic. One is, that is map tongue. Another is tongue filled up with fine bubbles of saliva all over the tongue. But here the thing has been described respiratory symptoms, and very important symptom is most important symptom, that lung problem. It covers pleurisy as well as the accumulation of fluid within the pulmons, that is air pockets alveoli, and these two diseases are very serious diseases, particularly the last one, the edema of lung may result in death of the patient. It's a very serious disease. Nat.MUR for circulatory organs: pain in apex pit area. Apex pit area I have shown in the picture. This is the apex pit area. Over the chest, actual heart. Worse from movements and deep inspiration. Pulse rapid and intermittent. Worse lying on left side. Beat of pulse felt all over the body, especially in persons of sanguineous temperament. Anxiety and palpitation with moroseness of anemic persons. Cardiac hypertrophy. Hypertrophy means increase in volume of the heart. Tendency to, there are reasons of hypertrophy is given. Please, if you are, I want to know, you are interested in the subject, please note these things. Tendency to lie down over and over. Limbs cold, numb, blood very thin, does not coagulate easily. The apex pit area is this particular portion. It is in the mid-clavicular region and fifth intercostal space, where mid-clavicle and fifth intercostal meet. That particular is the portion is called apex pit area above the chest area. It is just lying on the left side of this nipple, left nipple. Nat.MUR for back and extremities. Triple star, most important. Lankiness of neck of children, that is thinness. Very neck of the children is very narrow. Backache better when laying on some hard thing. This is a keynote symptom of Nat.MUR. The Nat.MUR backache is always relieved by lying down on some hard surface. Soreness in spine and limb, cold sensation in back. Occasional attack of osteoarthritis, chronic arthritis of joints. cracking sound of joints, arthritic pain, involuntary jerks of legs, spasms, moving of legs in sleep. Very important symptom. Moving of leg in sleep. The patient is sleeping, but his legs are moving. Ankles weak, stiff, arthritic swelling. Pain in sacroiliac joint in morning. Skin at the base of nail, dry, hard, torn. Warts in palms. Very, very important. You will get a lot of patient that was got warts in the palms. Pains in hips and hip joint, coxalgia, sciatica, pain in contraction of hamstring, painful contraction of hamstring, weakness of knees and calf muscles, artery of joint, synovitis, herpes. Like case, baby Molly, a 5 years age, actually 5 years, used to suffer from diarrhea almost always for last 3 to 4 months, sometimes passed 12-13 times stool a day. Limbs, head, hot to touch, had history of skin disease, liked cool air, foods and drinks, no lasting result obtained when remedies given homeopathically, health getting more lean and thin day by day, skin relaxed, neck lank, that is very thin, always craved for foods, irritable, whining type, new symptoms of fever added recently. I had been getting anxious with the health of the body. Once the mother of the baby informed, whenever she wants in kitchen, he was in kitchen, she used to eat salt directly. At once I prescribed Nat.mur 200x, 1 dose, 1 gram tab, a week for 3 weeks. Tab a week for 3 weeks. That is, in a week we will get only 1 tab NM 2x. After 3 days of getting first dose, the mother reported frequency of diarrhea minimized to 2 to 3 times a day. Betterment of other symptoms also noted. A advice to carry on remedies as suggested. Thereafter, the patient party didn't contact. Mind the peculiarities of the patient. This Nat.mur, the patient who lacks Nat.mur internally, he will have a crave to take common salt physically. But mind that that physical form of Nat.mur will not be absorbed in the system. As such, the person will suffer and suffer until and unless this potentized medicine in the form of either X form or homeopathically, Nat.mur 200, Nat.mur 1M, Nat.mur 10M, they will give fantastic and amazing results. Here also we get the same symptoms. See this? I have given him 200x 1 dose 1 week for 3 weeks. He is suffering from 3 to 4 months, and this suffering is gone with these few doses. This is the peculiarity of potentized medicines. With this, the video ends. Thanks for listening and viewing. If you got anything, something to say, please write down in the comment section. I will certainly respond.